Finding Your Way with Ocular Melanoma. Join me, host Tara McCannell, as I share with you everything I know about this rare cancer. I hope you will learn, get your questions answered, and be motivated to take charge of your own healing. Visit my resource page, sayhart.com/ocular melanoma. That's SEYHART.com/ocular melanoma for more content and support. There you will find my handbook for patients and families. You will find past recordings of episodes of this podcast, and you will find recorded live webinars that I have done over the past year on topics such as a holistic approach to ocular melanoma, mindset for survival in cancer, as well as everything you can do to understand your eye and keep your best vision. Stay tuned for more resources, more webinars. I look forward to sharing even more. Today is a topic that has been on my mind lately, and this is, did you get a second opinion? Many of you who are listening to this episode, maybe in the very beginning, you might just have been diagnosed, and there are so many questions that you have, and this is the first time you've heard of ocular melanoma. Others may already be undergoing their treatment or maybe being monitored or in a different phase of this journey with a possibility of having ocular melanoma. Why is it so important to get a second opinion? I don't know where to begin, but the number one reason is that ocular melanoma, the diagnosis of this very rare cancer, is not an easy one to make. And it is not only not easy, because sometimes, I'm going to say most of the time, we are not able to just get a tissue biopsy and know what it is. It's because some of the hardest melanomas to diagnose are the smallest ones. And it may not be possible to get enough tissue to send to pathology to actually get a pathologic diagnosis of the cancer. I'm going to talk a little bit about other biopsies that you might have that don't provide pathology, but that might offer the search for gene expression, which is not the same as pathology, but we'll get to that in a moment. Another thing is that ocular melanoma, making the diagnosis, is something that people need clinical experience to be expert at. If you've been in practice for 1, 2, 3, 4 years as an ocular oncologist, you are not going to have the bank of clinical experience behind you than a person who has been out for 10, 20, 30 years who have been treating ocular melanoma. The more you see in your experience, the more reference you have, the more able you are to say, yes, I realize that this is probably a melanoma and this is not. That is something we call clinical experience. Clinical experience takes time. Clinical experience requires the training and background and the knowledge. It just doesn't happen overnight. And one of my missions is to help the new generation of ocular oncologists get information faster, to accelerate their learning. And I have a previous episode about a group that I have formed and that we have met now. We've met on several occasions. It's called Oncology Mentoring Group. OMG is what I call it. And there we have a bunch of individuals who are fairly new to the field and are looking for information and they're looking for a forum. And I'm hoping that I can help impart some of my knowledge and experience to patients who might not even come to me, but who may be seeing some of the members of this group. And I'm hoping that this group can lean on each other, lean on me if necessary, to help guide them. So it is hard to make the diagnosis of ocular melanoma. Even a person who has a large tumor might not be diagnosed. And let me tell you why it is difficult and why we don't. Let me just back up. Why I don't get a biopsy on every patient to know what I'm dealing with. Many times, we don't get enough material for biopsy. We don't get enough material for the pathologist to say, we have a pathological diagnosis that this is a melanoma. So what is happening instead is that people are getting biopsies, but not sending the sample to pathology, but instead sending the sample for gene expression profiling testing so that we can know if the sample is a class 1 or class 2 tumor. The problem with relying on that information is that class 1, class 2, these prognostic designations that tell us if the melanoma is a low risk or high risk of spreading, of metastasizing, actually has nothing to do with the tumor in your eye. The tumor in your eye, if it's a melanoma, is a growing cancer and it needs to be treated. It doesn't matter what the gene expression profile test shows. And we have data that show us that the gene expression profile in growing melanomas can change and evolve with time. What does that mean? It means that if someone took a biopsy and found that you were class 1 and decided not to treat you, when your melanoma grows, it can change to a class 2. Do you want your melanoma to become at a higher risk of metastasizing as it slowly grows in your eye? I don't think so. The other thing is the accuracy of the gene expression profiling. It has nothing to do with your clinical outcome. It is not really meant to be used as a diagnostic test. And in my experience over the years, we have sent all sorts of tissue to for class 1, class 2 testing, and we always get a result, even if we send aqueous humor, which is a liquid in the eye that has nothing to do with a cancer. So you have to be careful. We cannot rely on these tests to know for sure what to do. And in my practice, the decision to treat your eye has nothing to do with what a biopsy or a sample shows. There is always enough information for me to know that you have a growing live cancer and that we can't just leave that in your eye. It doesn't matter what the prognosis is because if we just keep it growing, it's going to mess up your eye. And the vision result is always worse if we wait for things to grow bigger because we decided to hold off on treatment. So there's a lot of information here to think about, but you can get a sense that it is not always an easy diagnosis to make, ocular melanoma. So therefore, I recommend that every single person get a second opinion. It doesn't matter who your ocular oncologist is. Even if you're seeing someone who has 40 years of experience, and there are a couple people out there who have that, if you get a second opinion, you're going to learn more about what ocular melanoma is. You're going to learn more about how other people might treat ocular melanoma. And it doesn't matter, this part doesn't matter because you can decide who you want to have your treatment with. It is okay to get multiple opinions to learn more. And a lot of times patients will say to me, well, I feel really uncomfortable. Can you not tell them that I'm here because I really wanted to get a second opinion and I'm just so worried that my doctor is going to find out? Listen, it's 2025. We are not in a paternalistic healthcare system. Physicians, doctors, our healthcare system, it exists for you. It doesn't exist for the doctors or for doctors to feel good about themselves. No, you need to get a second opinion because it is for you. If your doctor is upset and feels offended or feels that getting a second opinion is disrespectful, you need not. That doctor is not with the times. When people tell me that their doctor doesn't want them to get a second opinion, I turn around and say, do you want to have that kind of person as your doctor? Because if your doctor doesn't want you to get a second opinion, that means your doctor doesn't want you to learn about your disease. And is that the kind of care that you want to have along this whole ocular melanoma journey? When people ask me about getting a second opinion, I provide multiple names. And if they're interested in traveling, these people, they can get second opinions all over the country. I'm totally fine with that. But I do recommend that they at least get the ball rolling with the treatment so we don't have significant delay. You know, today getting a second opinion is critical. And now the question is, how do I get a second opinion? What are the ways? Number one, ask your ocular oncologist. Say, because this is a rare cancer, I realize that it is in my best interest to get a second opinion, regardless if I end up having my treatment with you. Can you please give me 2 or 3 names of ocular oncologists who I can see in a timely way, where they can also review my case before I decide exactly what I want to treat? So ask your ocular oncologist who you can go to for a second opinion. Number 2, go to the internet, do the research yourself. There's plenty of information out there that you can find ocular oncologists. You can look by location, maybe there's somebody nearby, but also don't feel you have to be limited to your neighborhood, because whoever happens to be in your neighborhood is sort of default. I'm just saying that there are options. A lot of people will fly for a second opinion. So look yourself, do the research, find out who you can get in with, call the offices and try to get an appointment. How many second opinions you need? It's kind of up to you, but I would say at least one. A lot of our patients that come to me for second opinions have, they've seen 2 or 3 different people, and I think that's completely reasonable. Again, this is rare. Chances are that the doctor you're seeing doesn't have a lot of experience. Why not add to that? Why not feel really comfortable about this road that you're going to be going down, whether it's brachytherapy, another type of radiation, or even removing your eye? These are huge decisions. Why wouldn't you get a second opinion? And so I encourage you. One last thing, I've learned of a few companies that have popped up that are partnering with major healthcare insurance. And these are avenues where patients can get second opinions by doing a telehealth appointment. And in many cases, there is no additional charge to you. There's a company, I think, called Second Opinion, no, Second 2nd.com, and there are a handful of other companies that work with health insurance to make it easy for patients with rare conditions to get second opinions. So reach out to your health insurance and say, I want to get a second opinion. Do you offer a telehealth second opinion um, for myself as a member of your plan? This is becoming very popular now because health insurances are realizing that when patients get second opinions, they learn more. And oftentimes, not necessarily in the field of ocular melanoma, but all across medicine, patients who get a second opinion end up having less procedures. They have fewer interventions that maybe they didn't need in the first place. So, this can be a great benefit to your health and for you overall. Wouldn't it be great to get a telehealth second opinion and realize that you actually don't need to be treated? You don't need to undergo an invasive surgery that might hold you up for a while. So, this is not just in melanoma of the eye, it's everywhere. So, consider reaching out to your health insurance and asking about options for second opinions through telehealth visits. Um, I think this is a great thing to do. It really makes it easier for people to get second opinions. And, you know, and I think it is no issue if your ocular oncologist, your main doctor, knows that you are getting second opinions. Because why would that be good? Your doctor is going to know that you care about what's going on, that nothing is going to be left unturned. And it's going to keep your healthcare team on their toes. If you're the kind of person who takes charge of their health, who writes down all their questions, who asks questions and demands to have answers for all the things that you have going on in your head so that you will become more educated, you are going to receive a higher quality of care, not just in your treatment, but in the continued journey in your follow up. If you develop a complication, if something happens, and things are going to happen after treatment, you're going to get the kind of attention because your healthcare team knows that you care. And all of us have to take charge of our healthcare. I mean, this trend has been going on for many years. We are no longer in a healthcare system where you just do what your doctor says and don't ask questions. That maybe was in the 1980s and it started going away in the 1990s. And Healthcare is so different now. You have access to so much information. It is entirely possible, especially if your ocular oncologist is new, you can probably learn just as much as they can by going to the internet, by researching, by reading about your condition. And I encourage you, the more you know, the better you will do. And on that note, I want you to think about what are you doing that you are promoting yourself, empowering yourself so that you do the best in this healthcare journey? And what are ways that you could take steps? Is there something that is on your mind that you're thinking about that maybe you're not sure, you don't quite understand? I encourage you to this moment, when this episode ends, I want you to write down what are still open-ended questions, and I want you to tie the loop on each of those and figure out what you need to do to understand so that you will do your best. Thank you very much.